Hello, good morning, happy Sunday. Thanks for all of you who are here with me live. And if you're watching from the replay, go ahead and put that in the comments below. Today is a really good topic. We're going to talk about headaches, migraines, and sleep. There is a relationship between these three, and we'll dive right into it. I am definitely someone who gets headaches, not too frequently, thankfully, but they are associated with my period. So it's almost a sign I know my period's going to happen because I start to have these really severe headaches. It's really interesting. I'd say a lot of people do, in fact, have headaches, and there's a whole host of reasons why someone can have headaches. Certainly, caffeine withdrawal, taking too much medications actually can cause headaches. And when I was in training, I remember being a med student, I worked with a doctor who was actually a neurologist. So a headache specialist, and he said that he never has ever experienced a headache. And I thought that was so hard to believe because I just thought they're so common, just like catching a cold, like who hasn't had a headache? But I guess there are people who don't have a headache. And how do we define headaches? So headaches are just pain in any part of your head. Sometimes for some people, it can just happen on one side. Sometimes it can be on both sides. But really, it's typically isolated just to one spot. Sometimes it can move around. It can start, maybe a tension headache, sort of strain behind your eye, moves to the back of your head, and there it can feel differently. Sometimes it can feel like really sharp pain, can feel like throbbing, or just a dull, constant, irritating ache. Sometimes they can just come on pretty suddenly, and they can last for hours or even, unfortunately, days. I've worked with patients who've had such bad headaches, they turned into migraines and they had a difficult time working because of this. What causes headaches? Well, some of the research suggests that it's chemical activity in your brain, the nerves and the blood vessels surrounding the skull, or even the muscles can be tense in your head or neck, or a combination of factors can be the cause for headaches. Sometimes there's a genetic component to headaches, especially migraines. And we'll talk about, what migraines are. But common types of primary headaches, so not due to another cause, are cluster headaches, migraines, migraine with aura, tension headaches, and then particular lifestyle factors, right? We're always talking about lifestyle and how we can live whole lives here on Sleep Aura is alcohol, particularly wine. Sometimes when I drink, or when I used to drink, I would get a lot of like tightness right here, sort of behind my ears. Certain foods like processed meats that contain nitrates are associated with headaches. Changes in sleep or lack of sleep, and that's really the topic for today. Poor posture, right? If you, maybe are sitting like this, reading a book all day long, or, at your desk and you're not relaxing your shoulders, that can cause a lot of tension. Not eating has also been associated with headaches, and then stress. And that's definitely something I think all of us have experienced. And then secondary causes of headaches. So these are things like medical conditions that can cause headaches, acute sinusitis. So your sinuses are sort of right here behind your nose. There's also some in here as well. Um, Blood clots. So blood clot is, basically a collection of blood that, or I guess cholesterol too, can get stuck in your blood vessels, decreases oxygen from flowing, and that can cause it. Brain aneurysms, so widening of the blood vessel, brain tumors, concussions definitely can cause headaches. Dehydration, not drinking enough water, ear infections, eye issues, high blood pressure, the flu, you name it. Lots of different types of things can cause headaches. And then let's talk about migraines. So, how are migraines different from headaches? Well, they're usually more severe, and they're only typically on one side. So, throbbing pain on one side. And then people who have migraines report more worse symptoms. They can feel sick or nauseous, and they really need to go into a bedroom and turn off the lights and have it dark because they're really sensitive to light or even sound. It can make their symptoms a lot worse. It's a pretty common condition, and it's common more in women. 1 in 5 women have it, as composed to about 1 in 15 in men, and they usually begin around early adulthood, so maybe the age of 20s to 40s. It is suspected to have a genetic component, but also could be mediated by some of our hormones. Yeah, sort of like how myself, I can get headaches in and around the time of my period. And so People can also feel really nauseous and vomit when they have their migraine headaches, and sometimes it can last up to days. One specific finding for migraines is having an aura. So, an aura could be like a visual disturbance, maybe like a flashing light, some blind spots, or just feeling of tingling on one side. And it can be really, really scaring. Sometimes migraines can almost look like seizures, like partial complex seizures. Yeah. So, when we talk about sleep and headaches, what is the deal with that? So, there's a lot of different factors that have been involved: how long we sleep, our quality of sleep, if we have undiagnosed or untreated obstructive sleep apnea, and issues with our circadian rhythm. And some of the researchers discuss, and I'll link some of the studies that I reviewed in the comments below, is that not getting a good amount of sleep is really a trigger for headaches. And what does that mean? So, one study by Calhoun said that all migraine sufferers reported problems with their sleep. That's pretty remarkable. And is it because you're not sleeping well that's causing the migraines, or is the migraine just so painful that you can't fall asleep? Probably a little bit of both. Another study reported people who have a hard time sleeping have a higher probability over 3 months of getting a headache of all kinds. And this was about 5 times greater. That's a huge risk. And then people with headaches also can report poorer sleep, right? More tired, feeling fatigued, having insomnia. And people specifically who have obstructive sleep apnea. So if you're one of my patients who sees me in clinic, you'll see in my questionnaire, I ask if you wake up with a morning headache, because experience of awakening with headaches, about a third of patients who have obstructive sleep apnea. Typically, if it's undiagnosed, a lot of times it can get better, but not everybody gets better, right? Because there are also a lot of other things that can cause it. So, about a third of people do get better. And then it's fantastic because treatment really does improve the headache frequencies. One study put from almost 6 times, 5.8 times um, per month to like less than one, which is really, really remarkable. Yeah. So once you're breathing better at night, it does a lot to open up your airway, right? So sleep apnea happens when the muscles of the upper airway, typically the tongue, fall back. You have more awakening. Sometimes your muscles and your neck are all tensed. And once we open up that airway, you're breathing better, you're getting more oxygen. I feel like everything relaxes. The brain relaxes, the muscles relax, and you can sleep. And it can improve your headache. So people who've had their sleep apnea treated also needed less medications for their headaches, which is really great. And the reason for this is maybe not so clear, but right, the sleep centers are in your brain, and there's different ones, specifically like the hypothalamus, and then there's brainstem centers in our, part of our brainstem can affect whether or not we can have a migraine as well. That can affect our sleep. So the centers of our brain that can affect migraines and headaches and sleep may be shared. And it's said to be a disturbance in one may worsen the pain. So definitely, I've experienced this. I know people who have chronic pain. If they're not sleeping well, your threshold for pain can go down, so you're a lot more sensitive to pain. So getting a proper amount of rest. So looking for and treating any underlying sleep condition, whether it be obstructive sleep apnea, a restless leg syndrome, a movement disorder, a circadian rhythm, or even insomnia, it can help sort of really make you feel more relaxed. And so you're not as sensitive to pain. So poor sleep means that you can be more sensitive to pain because there's shared areas of the brain between the sleep pathway and the pain pathway. Interestingly enough, there was another study that said 2 days of stress or not even getting an adequate amount of sleep was associated with higher incidence of headaches. So more people are getting headaches. And then if we lowered the stress and we got more adequate sleep, that was actually protective. So sleep for the win. I think if you follow me, if you watch my videos, we all know that I'm always trying to find the benefits for sleep. And so yes, sleep can help with improving headaches and migraines. And interesting, another study in veterans who've had migraines, what they looked at is that when they just taught them simple things about sleep hygiene, after 6 months, their headaches improved. They used to have headaches at a frequency about 13 per month, and it went down to 2. So, really, really remarkable. Just a simple intervention as learning some things about not staying into bed too long, avoiding caffeine, right? Some lifestyle factors can really impact that pain, that headache, that uncomfortable sensation that you get. So, that's all that I have for today. If you have any questions about headaches, migraines, and sleep, go ahead and put it in the comments below. For those of you who are interested, I'll go ahead and add the references to some of the studies that I reported. So, in a nutshell, if you have headaches or migraines and you have poor sleep, make sure you talk to your licensed healthcare professional, your doctor about it. If you do potentially have an underlying sleep condition, please make sure that's addressed because your headaches or your migraines can get better as well. Hope you all have a great rest of your day. Sleep well. Take care. Until next time.